Thank you for watching Red 2's Module 7 and 8, Power of 3 on the current state of death panels. This presentation is the accumulated work of Alexandra Anderson, Alexandra Key, and Michelle Steffs. We will be providing a general overview of death panels and their current state within the United States healthcare system. The phrase death panel is a colloquial term for end-of-life counseling sessions. The phrase death panel comes from conservative Republicans after doctors could charge Medicare for these counseling sessions. During a death panel, doctors frankly acknowledge a dying patient's inevitability of death. This may seem harsh, however, there are benefits to these types of discussions. Discussion in death panels allows patients to concentrate on improving the quality of their lives rather than lengthening them. Furthermore, death panels open discourse for important topics including final arrangement of affairs, and saying goodbye to loved ones before it's too late. The first discussion of death panels came about in 2009 in coordination with Obama's Affordable Care Act, hence the widely used term, Obama Death Council. In full effect, death panels would be a part of a governmental agency which decides who would receive health care and who would not receive health care based on some form of standard implemented by the government. However, this rule requires no specific diagnosis and sets no guidelines for end-of-life discussions. Conversations center on medical directives and treatment preferences, including hospice enrollment and the desire for care if patients lose the ability to make their own decisions. Because these death panels are so open-ended, there was a lot of confusion and therefore backlash to this concept when it was first introduced. After being widely publicized, there was a heavy public divide on death panels. People even referred to these panels as pulling the plug on grandma. The most prominent figure in the controversy against death panels was ex-Alaska Governor Sarah Palin. Palin created the misleading notion that the panels would lead to the rationing of care, even though the panel has no say over what service Medicare covers. Palin made her assertions very personal and even claimed that the system was an evil one and that no one had the right to decide whether or not her Down syndrome child was worthy of health care. While Palin's emotional logic was sound, she failed to encompass the actual purpose of death panels. Her comments hit a real chord with voters, and Palin's claims was eventually voted 2009's Lie of the Year by PolitiFact. As recently as 2016, 29% of Americans still believed this widely debunked claim. Even after heavy debate, death panels were implemented into the United States healthcare system. In 2009, the Congressional Budget Office estimated that the proposal would cost $2.7 billion over 10 years, which would amount to $270 million a year. In 2017, nearly 28,000 providers billed almost $70 million for advanced care planning conversations, as reported by the Centers for Medicare and Medicaid Services. So far, death panels have costed less than expected. So even though there is no tangible estimate for saving money from patients foregoing expensive tests and treatments, the program is costing significantly less than expected. A few studies have actually found that hospital care for patients who get care consultations costs thousands of dollars less than care for those who do not. There are several pros and cons regarding the implementation of death panels into healthcare. Pros include billing. Billing does make a difference, as it puts these important discussions on the radar of more physicians. They'll care if they're getting paid. Furthermore, 250,000 people had an advanced care planning just within the first 6 months of implementation. This means that 250,000 people were allowed to participate in and make an informed decision on their end-of-life care. Freedom of decision. These death panels serve only to provide information and direction to those who are nearing the ends of their lives. Patients are not required to follow any suggestions made by physicians. On the other hand, cons include bloated medical bills. A third of Medicare spending goes to patients with chronic illness in their last 2 years of life. Are death panels worth further increasing this cost? Also, public stigma. Just the term death panel has a negative ring to it. There are many public notions against death panels, mostly untrue, including: first, death panels serve to ration healthcare. Second, government should not be over-involved in personal end-of-life matters. Third, these discussions are essentially a scientific questioning of how to pull the plug on grandma. There are certainly many important pros and cons regarding Obama's death panels. However, public opinions have swayed more towards focusing on the cons, which has made a significant impact on the implementation of death panels in the healthcare system. Currently, death panels are not very widely used, as the idea was said to be dropped as a direct result of public outcry. Government control over the intimate choices during end of life is a hard pill to swallow for those who respect the dignity of human decision. Therefore, more doctors are choosing to have end-of-life conversations regarding living wills and final wishes of care before a patient is in immediate life-threatening circumstances or is dying. This preemptive discussion is a way to improve patients' ability to make informed decisions about their care. So, even though the official governmental implementation of death panels has mostly failed, this function of the Affordable Care Act has opened conversation between doctors and their patients regarding future inevitable wants and wishes regarding end-of-life care. As stated, death panels are only loosely implemented into the United States healthcare system. In all of 2016, only about 17% of the 34,000 primary care providers at 2,000 practices billed for advanced care planning. There may be many reasons for this small figure, including the public dichotomy of stance on death panels. Furthermore, many physicians provide end-of-life recommendations without feeling the need to receive reimbursement for their consultation. Despite the dreary state of death panels currently, implementation figures are expected to grow as requests from doctors seeking advanced care planning information tripled in 2017. As death panels become more mainstream in the healthcare system, we have to be wary of this new avenue for Medicare fraud. Medicare fraud is a very serious issue in the United States healthcare system, as almost 10% of Medicare expenses are lost to fraud each year. Because Medicare covers the treatment of those 65 and older, Medicare will be a large financer of reimbursement to doctors for advanced care planning. Death panels will be yet another way in which criminals can commit fraud and seek reimbursement for services not rendered. Therefore, we must create creative solutions to ensure that less money is being lost to Medicare fraud. After discussing the history of death panels as a result of the Affordable Care Act, we have a couple of questions to promote in-depth thought on all of the material provided. First, what are the consequences of paying health professionals to offer important end-of-life advice, and what are some possible consequences for those who cannot afford to pay? Second, would hospice volunteers be able to provide the same advice as doctors but for a lesser cost? Brainstorm other specialized individuals who have vast knowledge in end-of-life care who could provide this information at a lesser cost. Thank you for watching Red 2's Power of 3. We hope you enjoyed learning about death panels in the United States and that you will take this information and hopefully use it someday in your careers or personal lives.